Hi, my name is Dr. David Payton. I'm here with Dr. Debo Adegbenro. He is the owner and the chiropractor at Michigan Spine and Joint Center. We want to just address one of the common issues that we see in our clinic a lot of the time. So many of our patients come in here with an MRI or an X-ray report that indicates they've got degenerative disc disease or degenerative joint disease. Can you explain what that is?
Yeah, absolutely. So basically, degenerative disc disease is pretty much wear and tear. If we could just bring it down to the simplest language. So there's something called the disc in your spinal column. So the disc is filled with pretty much water and cartilage. So as we tend to get up there in age, we start to lose water content in that disc, which could cause degenerative disc problem. And then degenerative joint dysfunction or joint disease is just wear and tear within the joint.
Same idea, basically, just a different part of the spine anatomy.
Yeah.
And is this genetic and is it curable?
That's an excellent question. I've been doing some research myself, and I've seen patients ask me, "Oh my gosh, my dad has it. Does that mean is this the reason why I'm having it?" So the research is inconclusive at this point. It's still ongoing. We don't have that 100% approval rate to say that degenerative disc disease is linked to genetics or whatnot. However, some researches that were performed actually did conclude that there is a possibility of a genetic component that could cause degenerative disc disease among, some family members that
Right.
do have, parents that.
I suppose it's a little bit like some families will have like a bad stomach, bad digestive system, or bad eyes, or whatever it is.
Yeah.
But getting back to that topic, what you're saying is that even though there may be that component, I'm reading between the lines that it's treatable, it's manageable.
Absolutely. That's the good thing about DDD. I'm sorry, DDD stands for degenerative disc disease, so we're just going to shorten that. So it's treatable.
Mm-hmm. Can you show us, just for the sake of those that may be watching, what you would specifically do? Say I was a 60-year-old woman, I came in with DDD on my lower back, what would you do treatment-wise?
And then just before we get into treatment, and I'm going to say this, it's not the end of the word. I don't want us to start panicking because a lot of patients come in and start freaking out that, oh my gosh, I've got degenerative disc disease, am I going to die? Am I going to be paralyzed? Let's just slow down. It's just a natural aging process that occurs. Is it treatable? Yes, it's treatable. And I'm going to demonstrate to you guys how we do that.
One researcher has said that the DDD is pretty much the gray hair of the spine.
Absolutely. Wear and tear, setting.
You're not going to worry if your hair starts going gray, so...
No. It's just a natural aging process that everybody has to go through.
Great, so I'm a 60-year-old lady, so can you show us how you'll treat me?
Absolutely. Why don't you tell me what's going on with you?
Well, my lower back has just been bothering me for weeks and weeks and weeks. I didn't really injure myself. I didn't, trip down the stairs. I've had a desk job for my whole life. I'm carrying a little bit of extra weight, and I smoke as well. I've been smoking for 20 years. I've only got the lower back pain. It doesn't go anywhere else.
Okay, so that's a good thing. If you don't have pain shooting down into your legs, that means the pain is localized. So what we want to do is we're going to put you on this machine here, all right? And just so you guys know too, not everybody that comes into my door gets the same treatment, so treatments are specific for individual patients. But in your case, what I'm going to do is I'm going to put you on this machine. Why am I doing that? Reason why I'm doing that is you've got DDD, degenerative disc disease. There is your disc is starting to narrow a little bit. So my job is I want to see if I can increase that disc space and hopefully induce flexibility into the joint as well as the disc. All right, I'm going to show you guys how we do that. I mean, have you go face down here for me? All right. So I'm just gonna push on your spinal column now. Let me know where it hurts. Does it hurt here?
It does.
Right there.
Yes.
All right, good. So what I'm gonna do is I'm gonna use a procedure or a protocol referred to as flexion distraction. All right. What does that entail? You guys go ahead and follow me now. So I'm gonna strap your legs down so you don't run away. No, I'm just joking.
That just holds it in place while you stretch the spine.
Absolutely. So
Okay.
I'm gonna contact this process here, then I'm gonna stretch this piece out. And basically what we wanna do is we're just gonna contact that level. At this point, we're thinking L4 or 5 level. So I'm gonna contact that, and then we're just gonna induce that stretch into the segment. So basically what we're doing is we are increasing the D space, okay? And also we're trying to increase the flow of water back into the disc. All right? You okay
Great.
there, sir?
Very good.
All right.
And I'll say for those watching that was very comfortable. It was a good experience.
Absolutely. And I mean, there are other protocols that you could do at home, like you said. There are stretches you could do. Obviously, dietary modification is very important.
Mhm.
But before you do any stretches, please don't rely on Google. I want you to go see a chiropractor, see your doctor, explain what's going on. They're going to examine you and then prescribe the necessary exercise.
Thank you, Doc. That
All
was
right.
very informative.
Thanks.
All right.